Okay, so let me share my slide. Okay, so for Chapter 17, Legal Ethics and Moral Issues of Healthcare. So there are 4 terms we need to define. First is morality. When you say morality, it is a system of conduct that is right or wrong, or it's a principle concerning the distinction between right and wrong or good and bad behavior. So it's our principle um, as a person or individual and our own distinction of right and wrong. While ethics is a set of principles relating to what is morally right or wrong, it's providing a standard of conduct or code of behavior. Ethical practices are usually the basis of most dealings between persons in a profession. So sometimes morality and ethics are used interchangeably, but to differentiate it, when you say ethics, these are rules or refers to rules provided by an external source. Example, you have code of conduct in your workplace or principles in the religion. So that's ethic. It's a set of rule, okay, by an external source. While moral refers to an individual's own principle regarding right or wrong. Okay, for example, in the community, they set their parang they have for the community, parang they have a rule that ano bang set natin? For example lang, in the community, um, they say that or has the rule na adultery is bad, but for you personally, it's not. So parang ganon. Or kaya lang ganito lang, parang masyado naman ano yung adultery. Vaccination is morally right to have yourself vaccinated in time of pandemic, but for you, in your own opinion or your own ano, it's wrong. So ganun lang yung difference between morality and ethics. So ethics is more on external source, yung ginigay ng community, ng workplace, ng institution, or ng profession as your guide between right and wrong, while morality is your own principle on how you distinguish right and wrong. Next is bioethics. So bioethics is a discipline devoted to articulation of good decision in practice of healthcare. So basically, this is just ethics in application to our healthcare. And then lastly, we have legal responsibilities. So these are actions or behavior authorized or based on law created and enforced by the government to promote sense of security for each individual. So aside from the ethics, we have responsibility or legal responsibility. This is naman based from the law in a certain place. So, doon nagbe-base yung actions mo. So what are the importance of bioethics or health ethics? First, it ables to or it helps us to make responsible decisions through correct moral reasoning and well-grounded judgment in healthcare situations. So they say that ethics is like your compass to help you in decision making, especially in different hospital scenarios. So if there's a scenario, what is the best action, okay, for that scenario. So the ethics is like your compass for them. It's your guide on what's action you should do or decision you should make in such situation. It enhances competence by understanding the patient. It to face complex ethical challenges that resulted from bioscientific development and basis for legislation and public policy. So there are four major ethical principles, and let's try to apply this in a healthcare setup. First is autonomy. When you say autonomy, it also means self-governance. So it means you have a freedom to make choices about issues that affects one's life. So we believe that every person has a freedom to choose, to decide for themselves, or a patient has a freedom or a right to decide what treatment, or they also have the freedom to refuse a treatment. So that's autonomy. It's the right to decide. Yeah, so that's right, the right to decide. Also, if a patient has a right or for decision, a doctor also has the right. So a doctor can refuse a patient, okay, um, for example, if a patient insists of doing a procedure that is not medically reasonable, a doctor can refuse that procedure or treatment. Also, a person can also, parang the autonomy is exempted, or some person is exempted to autonomy if, for example, that patient is cannot make sound decision, if meron siyang mentally incapacitated siya, or that person has a degenerative disease such as Alzheimer. Yung pag ganon, minsan hindi na mapapractice talaga yung autonomy. And one example also, if the decision is important for the community. For example, a person who have tuberculosis is required to have a treatment. Why? Kasi if not, it will affect the community kasi communicable disease si tuberculosis. So that is one way na exempted yung autonomy. Then we have justice. So when you say justice, it means fairness, to give to each one what he deserves or what is his due. So this is more on equity rather than equality. So an example here is in the emergency room. For example, ako, nauna akong pumasok sa ER, and ang reklamo ko, masakit yung tiyan ko. And a few moments later, may pumasok sa ER, nasaksak naman siya. Yan, ay mga extreme na example. Nasaksak naman siya. Okay, tapos inuna, syempre, ang uunahin ni hospital is yung mas may risk o mas malala yung situation. So kahit ako yung nauna, okay, uunahin i-treat si nasaksak kasi mas kailangan niya. So that is fairness and justice. So it doesn't mean na kailangan first come, first serve, but in the healthcare setup, sino yung mas may need, yun yung bibigyan ng treatment. And then, next is beneficence and non-maleficence. So beneficence means to do good. Okay, so it's something, it's more on to do, while non-maleficence is to do not, or do not do, or to parang do not risk. So ganun yung difference ng dalawa. Parang kasing magka-connect sila. So anyway, when you say beneficence, it's something that wait lang. So it means that a healthcare professional should act in the best interest of its patient. So that's beneficence, to do good for the patient. Kung ano yung best for the patient, that is beneficence. While non-maleficent is do not or will not intentionally cause harm to the patient. Okay, that's non-maleficent. So again, beneficence is to do good, to provide benefit to a patient. That is, yan. And then non-maleficent is to not do not do any intentional risk or damage or harm to the patient. So for the beneficence, for example, of course, you provide the patient with the best healthcare treatment, yan, to do good. While non-maleficent, okay, sometimes this is a conflict between for a physician. For example, we have there's a patient, there is two options for the patient. Yung isa, for example, the patient has a tumor and that tumor resides on the visual part ng brain niya. So, one risk is do not do operation but the patient will die. On the other one, you do the operation pero magba-blind yung patient. So, it's a dilemma for the doctor. So, kailangan niyang i-weigh yung risk and yung benefit ng procedure. So, that's how beneficence and maleficence guide in decision making sa healthcare practitioner. So, all of these four, in the healthcare setup, hindi siya once lang maa-apply or kailangan isa lang. Sometimes, they conflict with each other or sometimes you have to weigh all these four principles in making decision. So, hindi lang parang isa na autonomy, so kailangan ito lang, ganyan. But what I read, the autonomy is the parang pinaka-high. So, pag ayaw talaga ni patient, wala ka na magagawa. Kahit meron ka ng to do good, less yung risk ng procedure, if ayaw ni patient, wala ka na magagawa. So, ayan yun. But in cases that the patient cannot decide, of course, the principle that you will apply is the beneficence is to do good to the patient. Parang ganun. Okay. So let's have your example and tell me anong principle yung gagamitin nyo here. Anong principle yung ginamit dito? Okay. So a vehicular accident, after a vehicular accident, a patient was rushed to the ER where splenectomy was performed due to damage from the accident without the patient consent. So what principle was applied in this scenario? Anyone?
Ma'am?
Yes.
I think this is beneficence po.
Okay, correct. Okay, thank you. So that's correct. That's beneficence. So here, since maybe in this scenario, the patient cannot really decide, baka ano na siya 50-50 and then wala pa siyang family or walang siyang someone. So as a medical practitioner or a physician, the principle that will guide you is to provide a healthcare treatment to the patient. So that's how principle or the principle acts as a compass to a healthcare practitioner. So it's your guide in making decision. Okay, so that's it for the 4 ethical principles. I hope those are clear. Autonomy, justice, beneficence, and non-maleficence. Okay, meron pa ako isa. Wait lang. So I have a question here. So which of the following is an example of beneficence? So choose the best example. A, giving a patient helpful medication. B, distributing scarce vaccine randomly among society. And C, respecting a person. And D, giving a person the ability to make their own decision. So which is under or an example of beneficence? A, B, C, or D? And, sige, ano na lang, para lahat na lang, you can type your answers sa chat box. Okay. So, nag-gets niyo na. Okay, so the correct answer is, yan, thank you everyone. So the correct answer is letter A. It's actually giving the patient a helpful medication. So again, beneficence is doing good to a patient or providing a benefit. Ayan. Okay, tama na. Okay na. Okay, so yeah, so the letter D, giving a person ability to make their own, is more on autonomy. Respecting a person is more on that. And distributing scarce vaccine, I want. This is not list to the choices. Okay, let's go now to the next topic under this chapter. Patients' rights as declared in the Philippine Patients Bill of Rights. This is a very important, and it's nice to know that actually everyone should know their right as a patient kasi this will help you para hindi ka pagkaisahan or maliitin, you know, especially in our society wherein if you know or you have a list knowledge about something, it's easier for people to look down on you or bully you or something like that or take advantage of you. So anyway, this topic is all about the rights of a patient as declared in the Philippine Patients Bill of Rights. So the first one is the right to appropriate medical care and human or humane treatment. So every person has a right to health and medical care corresponding to his state health without any discrimination and within the limits of resources, manpower, competence available for health medical care at irrelevant times. So everyone has a right to be provided with right, appropriate medical care and treatment. So, walang pwedeng mag-discriminate sa'yo if you're a patient sa hospital na hindi ka pwede tanggapin except if merong limit sa resources, manpower ng hospital ng time na yon in relevant. For example, when when COVID happened, hospitals are really full packed. And there are cases, na alam naman natin the news, that there are cases that patients have been parang refused to be admitted. Yan. So, pwede yan, hindi natin ma-apply si right to appropriate medical care kasi nga, di din naman nila maaasikaso yung patient. So, kahit ang sakit sa loob na hindi tinanggap si patient, hindi nila din na magawa yung hospital. So that is one of the exemptions to this right. If the facility has a limit to its resources or manpower. But if not, again, everyone has a right to have appropriate medical care without any discrimination. Okay, so that's first right. And then the second is right to informed consent. So when this means that a patient has the right to a clear, truthful, and substantial explanation in a manner and language that is understandable to the patient. So all proposed procedure, whether diagnostic, preventive, curative, rehabilitative, or therapeutic, or within the person who will perform the said procedure, shall provide his name credential to the patient, possibilities of any risk, morality, or serious side effect problems related to recuperation and probability of success and reasonable risk involved. So this means that the patient has the right to know what procedure or treatment or is this patient going or will be going through. So meron siyang right to be informed of what will happen to him. And that's not just the procedure, but also the people involved on that procedure. So who are the people involved? For example, mag-opera sa akin. So I need I have a right to know what are the procedures in that treatment, what are the um, charges, financial charges, or and who are the doctors involved in that procedure. So minsan kasi parang hindi mo to alam, ang mangyari lang parang oo lang ng oo si patient. Pero yun nga, as someone, kailangan alam natin yung rights natin na ano ba yung mga gagawin sa'yo. Right mo yun, okay lang kang magtanong. So pag mayroong nainis sa'yo na nagtanong ka ng tanong, hindi yun tama. Kasi right mo nga na magtanong kasi katawan mo yun. So it's your body, you have to know what they will be doing with that body. So also example is um, blood extraction, 'di ba? Sometimes kasi parang we take it like obvious naman magpapa-extract ng blood ka, 'di ba? Kaya nandito sa lab. But no, as a medical technologist, you still have to do the proper procedure of introducing yourself to the patient, explaining them the procedure, what will be done to their blood or their sample, and then they have to know who you are. So there are cases na nagtatanong talaga si patient, anong pangalan mo? And kahit ayaw mong sabihin kasi baka ireklamo ka, you have to tell them na kasi it's their right to know who you are. So, you have to tell them na I'm Mary Cyrene, I'm your medical technologist. Minsan pag ginaganon, joke ko yung patient na, ay baka ireklamo mo ako sa HR ma'am ha. Pero yun, minsan pa joke lang. Pero yun, they have the right to know kung sino ka kasi magka-perform ka sa kanila ng treatment. So, exemption in the following cases. Emergency cases, of course, yung mamamatay ka na, kailangan mo pa ba mag-fill up ng pagkahababang informed consent? So, exemption yan. So, when the patient is at imminent risk of physical injury, decline, or death if treatment is withheld or postponed. When the health of the population is dependent on the adoption of mass health or program control. When the patient is either minor or legally incompetent, in which case a third-party consent is required. When the disclosure of material information to patient will jeopardize the success of the treatment, okay, in which the third-party disclosure consent shall be in order, or when the patient waive his right in writing. So, 'di ba, as I've mentioned, there are cases that the patient is minor or legally incompetent. So, who are the persons that can sign on behalf of that person? So, we have the spouse, the son or daughter of the legal age, either parent, brother or sister, or the guardian. So usually the rule here is the closest kin. So spouse, son or daughter of a legal age, either parent, brother, sister, and guardian yung last. Next, right to privacy and confidentiality. So the privacy of the patient must be assured at all stages of his treatment. The patient has the right to be free from unwarranted public exposure except in the following cases. So, cases such as when the mental or physical condition is in a controversy and the appropriate court in its discretion orders him to submit a physical mental examination by a physician. So, if it's a legal requirement, yan, ma-overrule or it's the right for privacy or to privacy is exempted. When kailangan for legal requirement. When public health and safety so demand, when the patient waives this right, and yun. When the patient waives the right on confidential nature and information, or when it is needed to continue a medical treatment or advancement of medical science subject to re-identification of patient and search shared medical confidentiality to those who have access to the information. So again, as a patient, we have the right to privacy and confidentiality, meaning the healthcare practitioner should not tell to anyone their results or their procedures or what procedure has been done to them, except again in cases na for legal issues or the community's health is at stake. So for example, yung mga first na COVID, parang though we do not want others to know na may COVID, but this is for the early cases kasi yan. Pero it's for the safety of the public. Kaya kailangan sabihin na may COVID para or for the safety nga nung public na yon. Also, there's a case before, how can we apply right to privacy as laboratory scientists? There's also a case na ginamit na scratch paper yung mga um, patient results. Diba? The results are printed, yan. And then may mga errors. So, ginamit silang scratch paper ng isang laboratory. So, that case parang violates the right to privacy and confidentiality. Kasi, the ginamit mong scratch paper and everyone can see the result of the patient. So, that is a no-no. Okay, do not use scratch paper yung mga results ng patient. Or for example, pag nag-hospital na kayo, may mga patient kayong artista, ganyan. Yun, it's one of the ethics that you should not be telling to your friends or colleagues na ito si artista ganito, positive sa ganito, or si ganito, parang nakita ko may ganti yung tae niya, kadiri, ganun. Yun. So, yan. Right to privacy and confidentiality. Nalala ko yung crush ng friend ko nung high school, naging patient ko. First, sinabi ko lang, ay, may patient kami, parang yung crush mo. Parang hindi ko sabi yung result. Ay, mga ganun. So, again, you have to, as medical practitioner, one of your ethics is to um, protect the right of the patient to privacy and confidentiality. Next is right to information. So this is actually parang same lang with the informed consent, wherein the patient needs to be informed about the treatment, the legal, and even the legal guardian has the right to be informed about the result of their evaluation, the extent of the disease, the medical treatment added, and even the fees, added charges to the patient. Yan, right? Yan ang patient to be informed of that. So, pwede kang magtanong actually. So, if ikaw ang patient, you have the right to ask kung ano yung results mo, kung ano yung nangyari sa medical treatment sa'yo, anong mga ano pa yung mga needed or ano pa yung mga charges sa'yo. So, yan lang naman yung right to information. Minsan kasi parang I notice natatakot magtanong yung, lalo na pag hindi nila alam, natatakot sila magtanong because they get intimidated with, let's just be real na lang na nakakatakot naman yung mga nasa mga registrar or sa admission ng mga hospital, minsan nakaka-intimidate sila. So yung mga tao na hindi to alam, especially yung hindi pa masyadong na-educate about here, hindi sila nakakapagtanong and minsan na ano sila, na parang nakaawa lang kasi they don't know it. They don't know their rights, so hindi sila nakakapagtanong about their situation. But again, this is a right. So kayo, if in cases na you have questions, if you have someone in the family, remind them that they have the right to be informed of their any medical treatment. Next, right to choose healthcare provider and facility. So we have the right to choose ano yung gusto nating healthcare hospital. And we have freedom to choose the healthcare provider to serve us, as well as the facility, except when he is under the care of service facility or when the public health and safety so demands or when the patient expressly implied waives this right. So patient has the right to discuss his condition with a consultant specialist and at the patient request and expense. He also has the right to seek second opinion. So may right naman tayo to have our second opinion and if appropriate from another healthcare provider or practitioner. So okay lang yun na if you feel like hindi ka confident sa diagnosis ni doctor, you have the right to have a second opinion from other healthcare practitioner. Next, we have right to self-determination. So the patient has the right to avail him of recommended diagnosis and treatment procedures. So any person of legal age and sound mind may make an advance written directive to physician to administer terminal care when he or she suffers from the terminal phase or terminal illness, provided that he is informed of the medical consequences of his choice. He releases those involved in his care from any obligation, and his decision will not prejudice the public health safety. So this is example of this are yung mga do not resuscitate na mga waiver, 'di ba? May mga ganung patient. So those are patient that exercising their right to self-determination. If ayaw nila magpa-intubate or ayaw nila resuscitate if mayroon parang hindi na okay yung situation nila. So they are practicing their right to self-determination. So we have that freedom also to do that. Okay, next, right to religious beliefs. So, the patient has the right to refuse medical treatment or procedure which may be contrary to his religious belief, subject to the limitation described in the preceding subsection. So, provided that the right shall not be imposed by the parents upon their children who have not reached the legal age in a life-threatening situation. So, example here, hindi ko lang i-name drop, but there is a denomination wherein they do not want other blood products to be transfused sa kanila. So may ganong religion na, and we should respect that. That's their belief. So ayaw nila na may masasalina na dugo. So usually they have card, and pag may mga accident, may mga ganon na chinecheck if member siya ng ganung religion, and then they have card na do not transfuse blood, mga ganyan. Okay, so they have the right, okay, to refuse any treatment that is against their belief, provided, okay, so this is exempted in cases na it's the parents that impose that right to the children na hindi pa legal age. Okay, so especially in life-threatening situation, pwede nating itong i-ano kasi hindi pa makakapag-decide yung bata, and it's not good that the parents will impose that to the children, especially in a difficult situation. Next, right to medical records. So, patient is entitled to a summary of his medical history, condition at his expense and upon discharge of the patient. So, he may obtain from the healthcare institution reproduction of the same record whether or not he has fully settled a financial obligation. So, you also have, or a patient has a right to have a copy of his medical history or condition, okay, kahit na meron pa siyang charges or financial obligation sa hospital. Kasi usually, di ba, there are institutions na they will not give you your record unless you pay or you fully pay the your charges. So, learning here that you have the right to have your records be given to you kahit may ganun ka. Healthcare institutions shall safeguard the confidentiality also of your medical records and likewise ensure the integrity and authenticity of the medical records. Healthcare institutions shall issue medical certificate to patient upon request, and any other document that the patient may require for insurance claim shall also be available to him within reasonable period of time. Next, 9, right to leave. So the patient has the right to leave the hospital or any other healthcare institution regardless of his physical condition. So if ever, kunyari, in the middle of the treatment, the patient want to leave the hospital, parang ayaw na niya doon, he or she has the right to leave, provided that he is informed of the medical consequences of his decision. So normally maraming ganito sa hospital din kasi when I was working sa PGH, may mga ganyan cases na, ay wala na po si patient, nag-sign na siya ng waiver na, uwi na siya, parang ganon. So he or she, may mga patient kasi na they rather parang, if they feel like they're dying, they rather die na lang sa bahay. So they'll give a waiver na they practicing their right to leave, and yun nga. So again, he is informed of the medical consequences, releases those involved in his care from any obligation, and will not prejudice the public health safety. Okay, so that is the right to live. So pag ayaw na, di iwan na. Ganun lang. Just lang. Okay, next, a right to participation in medical research. So the patient has a right to be right to refuse participation. So the patient has the right to advise if the healthcare provider plans to involve him in a medical research. So you can, kasi maraming research sa hospital. So they will give you options like, would you want to join this research for that is very, parang appropriate for your case? So as a patient, you have a right to refuse to join in that medical research. Then 11, a right to correspondence and to receive visitors. So the patient has the right to communicate with relatives and other persons to receive visitors subject to reasonable limits prescribed by the rules and regulation of the healthcare institution. So the patient, again, the patient has the right to receive and to communicate with their visitor. However, in time of COVID, remember the early time, visitors are not allowed for COVID patient, and even guardians were not allowed for COVID patients. Naawa talaga ako dun sa time na yun because I had several patients na parang mag-isa lang sila, yung iba parang matatanda na. Like I have one very mapakwento na ako anyway. My very old patient, parang mga 80s na siya, si tatay, si lolo, and then sa private room naman siya. Sa private room siya, mag-isa lang siya. And bawal nga yung guardian, so siya lang mag-isa doon. And then one time, siya yung patient ko. So kuha ko ng dugo sa kanya. The parang ka-video call niya yung family niya. And then nakiusap si anak niya na, "Can you help my father?" Ganyan. Kasi yung maleta ni lolo ay nasa flooring. Eh, hindi niya makayuko kasi masakit na. So parang nakakaawa lang. So I help lolo na lang na itaas yung kanyang maleta dun sa isang chair para mas madali sa kanyang mag ano, ay may pagpalakpak. Hindi, parang nakakaawa lang, 'di ba? Parang gano'n. So, tapos yung mga nurses, rare lang sila pumunta talaga sa rooms kasi parang may limit lang yung exposure mo sa COVID patient. So, hanggang dun ka lang. And then, yun. So, yun lang naman, nakakaawa lang. Nala ko lang dito sa right to correspond to receive visitors. And even especially sa charity ward is so different from private ward. Sobrang nakaawa yung patients doon. So, yun lang. Anyway, next is right to express grievances. So the patient has a right to express complaints and grievances about the care and services received without fear of discrimination, reprisal, and to know about the disposition of such complaints. So this will actually help us in how to handle patient na mareklamo. So, ang daming patient na mareklamo. Yan, nakakatakot. Especially if kaya medtech din yung patient mo, tapos nagreklamo siya sa'yo. But again, you have to know that they have the right to express their complaints, their disappointment. Right nila yon. So, having that in your mind, it will give you a good perspective or point of, how to handle it. So, you will understand na lang them na, sige, right mo yun. But again, if ikaw naman yung may nagre-reklamo, I hope lang, no, people will be more educated on how to complain correctly or properly. Hindi yung kailangan parang nasa palengke. Diyos. Anyway, wala lang. Parang cringe lang yun for me, yung mga nagaganong reklamo. But again, they have the right to complain. And yan. So, this is also good, especially dun sa mga tao na feeling nila na agrabyado talaga sila. Okay? So, they have the right, if they know this, diba, they'll given more courage to express their disappointments. Kasi pag hindi, hayaan na lang nilang gawin yun sa kanila. And lastly, we have right to be informed of his right and obligation as a patient. So every person has the right to inform of his right, obligation as a patient. So you can inform your patient na, sige lang ma'am, you can ask question because it is your right. Ma'am, okay lang mag-explain, it's your right. Okay, let we handle it. And lastly is the professional standard. So every profession has their own code of ethics. So medtech has their own code of ethics. Doctors, physicians, nurses, teachers have their own code of ethics. But this one is a general professional standard. First is you should perform only procedure for which you have been trained and are legally permitted to do so. As medical technologists or clinical laboratory scientists, we should only perform procedures that we are trained to do so. So just like kung extraction lang yon, yan, we should not be doing like, lala ko lang yung mga friends ko, gluta drip daw. So, hindi natin yung ginagawa. Kasi there people are asking me, baka pwede ka mag-gluta drip sa akin. Hindi, nag-extract lang ako ng dugo. Hindi ako naglalagay ng something sa katawan. Ako yung nagtatanggal. So, we do not perform gluta drip. And then, use approved correct methods while performing any procedure. Obtain proper authorization before performing any procedure. So, yan. And then, identify the patient. That's a professional way. So, hindi ka lang medtech na pupunta sa kwarto then kukuha ng dugo. Tapos ma-shock na lang yung patient sa'yo nung ginagawa mo. You have to really, it's a professional standard that you have to introduce yourself to the patient, tell them the proper procedure. So, obtain their patient consent before performing any procedure. Observe all safety precautions and keep all information confidential. Never discuss the patient or his or her condition with family and friends. Na si patient ganto, ganyan. Never discuss the patient's illness and the patient's presence with another worker or family member unless it is within the scope of practice. And then refer to questions by the patient regarding his or her disease and treatment to the physician in charge of the patient care. So, wag niyo chika, wag kayong marites, no? Wag tayong ganun. Mga clinical, medical, or laboratory scientist na marites. Wag ganun. Okay, we have to keep the information confidential. Pero alam nyo ba? Ay, joke lang. Ang marites. Pero alam nyo ba? Okay, teka lang. Yan. So, I remember lang, this is sidetrack. I remember lang, dami kong kwento. I remember I have one patient, wala siyang, yung isang paa niya naputol na. And then, ang nagbabantay sa kanya yung asawa niya, of course. Pero, ang nakakatawa doon kasi, galit na galit tong asawa niya kasi, siya yung nagbabantay. Ako naman, nag-extract lang ng dugo. Ang nakikichika yung nurse. Nakikinig lang ako. Pero pinatagal ko yung pag-extract ko ng dugo para malaman ko yung buong chika. Marites. Tapos, ang sabi nung kaya pala siya galit sa asawa niya, kasi yung asawa niya, dalawa na yung dalawang paa na niya yung dalawang legs niya na yung pinutol. Yung una pala talaga, isa lang. Tapos sabi nung nurse, bakit naman po misis, dalawa na, ganyan-ganyan. Tapos sabi niya, sabi ng mga magulang niya, nagchichismis lang tayo sa class. Sabi nung asawa niya, paano daw kasi may kabit tong si tatay. Tapos, inangkas niya sa tricycle yung kabit niya. And then, naipit ata yung paa niya doon. Kaya yun, na-hospital si tatay. Kaya sila nasa hospital. Naiinis tong si Mrs. Kasi nga, bakit siya ang nagbabantay? Ayan, deserve daw. Bakit siya ang nagbabantay? Yung kabit nga yung dahilan, ba't na-hospital yung asawa niya? So, kaya pala naging kabit kasi, at si kabit, ang dami ko nakuha, no? Tuntong si kabit ay, kapitbahay ata nila kasi si Mrs. nasa Japan nung time na yun. So yun. So yun yung kwento na kaya sila nasa hospital. And here's the catch. Isa pang na-shook ako kasi si Kabet pala ay nurse aide doon sa kabilang department ng hospital. Nasa pediatrics lang. Hinanap ko talaga siya. Sabi nung nanay, ay, nandiyan nga yung nurse eh. Nandiyan nga yung Kabet eh. Nandun sa kabila sa may pediatrics. Ganyan na siya. Tapos yan. Ayun lang. Tapos umalis na ako. Kasi tapos na yung chika. Nalaman ko na yung story. So, okay na. So, okay na po kayo, sir. Nakuha ko na po yung dugo nyo. So, ganun lang. Hindi naman yung result yung na-chika ko. Yung nangyari lang sa kabit. Ang funny lang. Kaya yung mga kasama ko sa work, ba't ang tagal mo dun sa ward na yun? Kasi ang tagal niya kunan ng dugo. Pero chinika ko kasi ang tagal ng chika ni nanay. So, yun lang. Okay. Back na tayo sa class. Okay, so next is, move on na ulit. Think before you speak and carefully consider everything you say. Ayan, so wag tayong medyo palangkera sa mga patient natin. Nakakaganong binit. Minsan lang yon, minsan lang tayo makakuha ng chika. Ayan, minsan yung ibang chika, ayoko na kwento, very confidential. So, ayan. Basta, ang funny lang pag nasa patient ka, dami mong chika. Wow, nakaka-motivate ba yung chika? So, next is treat all patient equally regardless of race, religion, social, economic status, gender, or nationality. So, kahit gaano pa yan kabaho, kahit gaano pa yan kabango, or kaitim, or kaputi, yan, you have to treat them equally. One of the rules nga in extracting blood, 'di ba pag ng alcohol, nagki-cleanse tayo nung arm ng patient, never look at the cotton ball. So, wag niyo titignan yung cotton ball after yung linisan. Kasi may mga student na titignan nila after maglinis, parang matik sa kanilang titignan yung cotton ball. Paano kung madumi makita mo? Tapos hindi mo mapigilan yung facial expression mo. So, one of my sa student ko, wag niyong gagawin yan. Wag niyong ipapakita yung nandiri kayo. May patient nga ako parang green na yung cotton ball after. Lumot na, ganon. Pero yun. So, yun lang. Share ko lang. And accept no tips or bribes for the care you provide. Though, minsan hindi napipigilan. May nagbibigay talaga. Yan. Sayang nga hindi natuloy yung jowa na nareto. Yun ang hinantay ko charot. Pero yun. So, may mga nagbibigay talaga. Like, I have one patient, nagbigay siya ng mga chocolate. Naku, kulang na tayo sa oras pag nagkwento ko ulit. Yun. So, yun. Next, if any error occurs, or you make mistake, report it immediately to your supervisor. So, kailangan alam ng supervisor. Kahit sobrang nakaka-guilty, you have to tell your supervisor about it. And then, behave professionally in dress, language, manners, and action. So, wag siya ladong bakla pag nasa pasyente, okay? You have to properly talk to them, yan, and dress appropriately. Kaya nga in the clinical division pa lang, we are training na the students na when you wear your uniform, you have to wear it in a professional way, like yung mga undershirts ng guy. Alam mo yung white yung uniform mo, pero bakat yung mga skull na print nila sa t-shirt, something like that. Or the ladies have their underwears bakat. So, ano naman pake namin kung pink yung bra mo, diba? Like that. So, ayan. Anyway, so just make sure that you present yourself in a professional manner. Even the dress, your hygiene, yun, important din yun. Okay, so that's it for this chapter. Yeah, and then I also remember dito, no, one of parang sikat ngayon na issue in TikTok is the teacher, yan, who danced like that. So you decide after learning this, is it ethically correct? O kung okay lang yung ginawa niya, content lang naman. Or in a professional point of view, is that a proper action? Yan. So, yun lang. Do you have any question, clarification? No more chika. Next time na. Do you have any question, clarifications? If none, so on Wednesday will be your pre-final exam. The result of, you can open your quizzes tomorrow. And hopefully matapos ko siya this evening. Quizzes tomorrow, i-open ko siya. And the result, hopefully matapos ko rin siya within the week yung result ng midterms niya. So that you can decide which exam you will take for the remedial. If you do not have any more question, class dismissed. Thank you, everyone. Ay, sige. Sorry naman. Wait lang.
Ma'am, may question po ako.
Ay, may question po. Sige, wait lang. Sinong una? Saidin, sige.
Ma'am, bakit po yung iba pong hospital hindi po sila nag-a-admit ng temporary po sa mga wala pong pambayad?
Yun nga, that will, especially for the private hospital, kaya kasi the private, okay, they will not accept yung mga walang, I think that's the rule of their hospital since they have the right kasi private sila. But for the government hospital, yung right not to have an equal or yung first right natin, yan, to appropriate medical care, it is applicable. Pero for private hospital kasi, it's a different parang rules. And since they're private, yan, meron din silang set of their rights on which paano sila mag-admit ng worker. For personally, I do not like that kasi everyone should be treated first, di ba? Bakit hintayin mo pa? Especially if it's emergency cases. May mga na alam akong scenario na mamatay na siya pero maagapan sana kung tinanggap siya ng first hospital pero hindi. So, ganun. So, yun. So, this one is more appropriate, parang mas ano siya sa government setup. And the private hospital has their own kasing rules that they follow. Yun lang. Any more?
Ma'am, ano po ulit yung coverage ng pre-finals?
Coverage 15, 16, 17.
Ilang items po?
Siguro mga 60 lang. Natatawa ako sa mga comment nyo. Meron pa kayong question? Yan. Okay, wala na. Okay, class dismissed. Thank you, everyone. God bless sa exam.
Thank you.
Thank you, ma'am.
Thank
Bye,
you po.
ma'am.
Thank you po.